Welcome to Hearts and Souls and our review of Lynne McTaggart's book, What Doctors Don't Tell You. There are vast numbers of things that doctors don't tell you or anybody. That is partly because there is so much to know about human beings, their problems and illnesses. Setting the enormity of human living and dying aside, there is also an obvious need for physicians to know and understand health. As sophisticated as it is in many regards, medical science utterly lacks any understanding whatsoever of the extraordinary dynamics of the human body, says Ms. McTaggart. But health is not part of the standard medical school curriculum. So how could physicians really know much about it to share with patients? Disease is their calling. They spend hundreds and hundreds of hours studying disease and diseases, but doesn't understanding disease suggest the need to understand health? Often, trained physicians don't even know what they are supposed to know, because medical science is a rapidly moving target. Then there are gaping holes in the training of physicians as suggested previously, and questions are often not asked. Patients are often unprepared or simply afraid to ask questions. When they do, such questions may be taken as affronts to the education, reputation, and goodness of the practitioner. Patients dare not embarrass their doctors. So, Lynne McTaggart wrote this book 20 years ago to tackle some of the numerous questions worthy of asking. Her questions are largely related to specific diseases and treatments, drugs and operations. Much was left unaddressed. Nonetheless, she gave it a worthy try, and her effort has much value, particularly as a resource when consumers have questions in the areas of diagnostic procedures, prenatal testing, screening, vaccination, as well as medications, operations, and technology. To this physician viewer, what Ms. McTaggart did address was well handled, although long, in statistics and data. A modest number of personal and patient stories are included in her book, intending to drive home certain points. Like few other writers, McTaggart quite bluntly takes on the medical system more than individual doctors. Quote, "The problem isn't the carpenter, but his tools. The fact is that medicine is not a science or even an art. Many of your doctor's arsenal of treatments don't work. Indeed, have never been proven to work, let alone to be safe. It is a false science built upon conjuring tricks, supposition, and blind preconceptions, whose so-called scientific method is a vast amount of stumbling in the dark." She repeatedly points out how so-called medical science has really studied little and often poorly the methods and practices it follows. A great deal of what we regard as standard medical practice today amounts to little more than 20th century voodoo. Medical science is, in the main, a triumph of statistics over common sense. 2/3 of medical practices don't have any proof at all. There is no such regulatory agency like the Food and Drug Administration to monitor surgery, screening, or diagnostic tests. McTaggart says, "The greatest reason that medical research is tainted is that the majority of it is funded by the very companies who stand to gain by certain results. It's wise to keep in mind that this industry, in a sense, has a vested interest in ill health. If drug companies found cures rather than lifelong maintenance therapies, they'd soon be out of business. Many fundamental issues persist regardless of medicine's long journey and McTaggart's valuable effort. Someday, medicine will add health and consciousness, spirit, and nature to their studies. Knowledge, real knowledge, will be approached in the curriculum and in practice. In the meantime, physicians and patients settle for so-called medical science. In practice and in fact, medicine is not based on science, it's based on faith. So said her early mentor, Robert Mendelsohn. McTaggart, for some years, helped him put out his newsletter, The People's Doctor. For more on Mendelsohn, see our review on his Confessions of a Medical Heretic. Lynne McTaggart concludes her book on the questions and quandaries of medicine, reminding the reader of its major shortcomings juxtaposed to the natural human form. Quote, medicine never takes into account the exquisite mechanism of the organism it is trying to fix or the body's extraordinary potential to operate. McTaggart goes on to say that, more often than not, your doctors often don't know what they are doing, not because they aren't good people with good intentions, but because the equipment inside their black bags doesn't work particularly well. In fact, most of the time, your body can manage things better than any doctor can. Lynne McTaggart is an alternative medicine author, publisher, journalist, lecturer, and activist. She is the author of 6 books and is the co-creator of the alternative medicine magazine called What Doctors Don't Tell You.